I talk to a lot of patients in the clinics, on the phones, Skyping, WhatsApp, all over the whole world. And I get a lot of the same questions, and it really comes down to understanding why you have back pain and what you can do and should do for your specific problem. So it came up about, is it better that I stretch or is it better that I do exercises? What is the best for the back? And when you understand how the back works and what can happen to the back, you can make better decisions. And we put together a program called 10X. This is not a sales pitch for the 10X because somebody said all I do is sell stuff. The 10X is about understanding what's happening to your spine, so you know what to do, and then you can do it, and then you can make your spine strong and resilient, and you can live your life without any back pain or any fear because you've eliminated the myth, the back pain myth. There's a lot of mythology about what's causing back pain or what you need to do, or if you don't get better by one treatment, then you need surgery. None of that is true. We've done the studies, 7 different studies, several of which have been published, more that will be published in the not too distant future, about what causes back pain and what you need to do to get it better. Because there's a lot of confusion, and when there's confusion, the unknown leads to problems that can't be solved. The known, when you know, then you can solve the problem. So this is about stretching or exercising, and it comes down to why you have the tight muscle and what the tight muscle is doing when you stretch it to the spine. That's the key. The goal is to do activities that don't aggravate the discs. When you aggravate the discs or the facet joints, the little joints, the pain very often gets worse. So if you're doing an activity that's designed to solve the problem but actually is aggravating the problem, and you can't figure out why you're not getting better, because you're doing the wrong thing. There's a right thing and a wrong thing, and everybody's a little bit different. And we describe that in the 10X, what you have to do. 24 vertebrae between the head and the hips. The vertebrae are the bones. In between each bone, there is a disc. The disc allows for motion. The disc is like a jelly donut. It's the only joint in the whole body that has a structure like the disc. It's weight-bearing, designed to move, but also very protective of the spinal cord. It's the disc that tends to cause the problems. The disc is a jelly donut, like I said, in the sense that the outside of the disc, there's a thick material. Inside the disc, there's a jelly-like substance. That jelly-like substance can move a little bit. And as it moves, as a result of activities, bending, lifting, twisting, sitting too long, we live in a culture where we're very, very, very sedentary, but all these things will load the disc. And when the disc is overloaded, it starts to break down. And when the disc starts to break down, you get some tearing. This is the key. This is the lesson for the day. It's the tearing. As it tears through, the nucleus starts to push out. Well, some patients, they get worse when they bend forward. Some patients get worse when they bend backward. And what it's doing, and when it's getting worse, is it's aggravating the tear. And when you aggravate the tear, you get more inflammation that builds up, and then you get more aggravation to the nerve as the nerve exits through the spinal canal, through the opening. So it's the inflammatory process. It's about proper movement patterns. When your movement patterns are not functional and you're not doing well with your movement patterns, you overload the tissue, which then starts to break down. And then you get a bulging disc, and then you develop a herniated disc. So the key is what is happening to the disc. It's the tear. Now, I talked last night or the night before about sitting and what it does to the hips. What we know with sitting My little friend over here, he's sitting. You get tight hip flexors, which are the muscles in the front of the hips. Hip flexors here, okay? The femur's here, and then it attaches, and there's a muscle that lifts up the leg and makes the leg do this, right? Okay? That's the hip flexor. When the hip flexor gets tight, causes irritation to the joints, which causes pain, causes what's called reciprocal inhibition. The nervous system, the tight muscle, causes the muscle that does the opposite activity to get loose. How does this work? I lift up my arm, my bicep contracts. As my bicep contracts, my tricep relaxes. They communicate with each other. It's called reciprocal inhibition. Very, very, very important, because this is why you have tight hamstrings. Reciprocal inhibition causes the tight hip flexors cause the reciprocal inhibition, but what it does is it turns off the glutes, the muscles in the back, the big muscles, the butt muscles. Okay, the biggest muscle and the strongest muscle on the body, the glute. When the glutes are tight, or when the hip flexor is tight, the glute gets weak. So what happens when you have a weak glute? Well, then the hamstrings start to do the work. So you get tight hamstrings. So the question is, do I stretch the hamstring or do I strengthen the glute? This is the question. If you don't strengthen the glute, you'll forever have a tight hamstring because they're doing the work of the glute. So you do the exercise, and then you may never need to do the stretching. But what happens is people are stretching. Well, to stretch the hamstring, you have to sort of do a little flexion with the hips because you have to lengthen the hamstring. The only way to do that is to flex the hips and lean into it and stretch the hamstring. Well, what happens is very often you start to do this, the old hurdler stretch. Yeah, I'm going to do the hurdler stretch. Well, what happens is you start to aggravate this, the tear. So you're flexing forward, trying to stretch the hamstring, and the hamstring's tight because the glutes are weak, and the glutes are weak because the hip flexor's tight because you sit too long. Right? Sitting too long, hip flexor's tight, causes the glute amnesia, causes the hamstrings to get tight. Tight hamstrings cause bending of the spine. We've talked about the bending of the spine being very, very bad. So the key of all this is if you stretch the hamstring and you don't strengthen the glute, you'll forever have a tight hamstring because the hamstring is doing the work of the glute. When the hamstring does the work of the glute, it's going to be tight and it starts to pull on the pelvis. And what it does is it kind of locks you up, so then you become a bender, a spine bender. Spine benders then don't get better because now they're aggravating the disc. I'm not trying to make this complicated, but this is how it works. When you understand why it is happening, you'll make better decisions about what treatment you need, which is exactly what we do in the 10X program. We spell it out. We help you identify your movement patterns, what's making you worse, what makes you better. We focus on making sure you're not a bender. Do not be a bender. We have 21 tips to make sure you're not a bender. You follow these tips, you bend less, the disc pain goes away, the disc physically gets smaller, takes the pressure off the nerve. We loosen up the adhesions by maybe doing some nerve glide or nerve flossing, and then you can free up the nerve, and then the sciatica starts to get better. And then your life gets better, and then you physically get stronger, and then you're able to do more, and you live more life, and you have more fun, and you have less pain. That is the goal. That is what we do. Don't be a bender. If you're a bender, you're going to have trouble. Why? Because of the disc. It's all about the disc. All right? So what do we have to do? We have to do squats. Well, you're not going to start with weight on your shoulders. What you really start with is stabilizing the spine to make sure the spine is strong enough to maintain the squat. And then you have to start to stretch the hips to make sure the hips are loose enough to be able to get down to a position. Okay, maybe I shouldn't have said the word stretch because we're not talking about stretching, but you need to make sure you can get into the position where you're not causing what's called the wink. Okay, if you're doing squats and you go too low, you're going to flex the spine, so you have to be able to get into a position. Really simple activity. Work the muscles, strengthen them, stabilize them. Okay, that is why we have the tips. There's 22 tips. But more importantly, the program spells it out. What's the goal of the program? So you understand what the problem is. When you understand why you have the back pain and what you need to do it, you can get stronger, more fit, more functional, and have a better life. That's what we do. I can make it better. Okay? We have the ability to solve the problem in the disc. You can do this. Okay? It takes time. If you don't give up, you get better. Somebody said, how do I get to a 4th degree black belt? Well, I didn't give up. That's how you get there. Here's what it is. http:// whatever that is. This thing here. Apparently you need that. www.totalbackpainrelief.com 10x order. That's what we do. Cody, come here. Come on, Cody, come. That's what we can do. I even got my dog. Come over here, man. Come on. Come on. Say hi. Say hi. Come on. Say hi. All right, that's it. 10x. Start to live your life. Get your life back. Go get him. Sorry. Oh, son of a gun.